The diagnosis of epilepsy is similar to the diagnosis of many neurological diseases. What that means is we use history, a little bit of physical exam, and then a very little bit of other diagnostic testing. So when we talk about the neurologic history, we want to get a good explanation from both the patient who has a spell or has something that looks like a convulsion to try to make that diagnosis of seizures and repeated seizures being epilepsy. We also want to do a physical examination to see if there are any residual problems going on. Most patients with epilepsy have a normal neurologic examination in between the seizures. And then we may want to do diagnostic testing. Some of the diagnostic testing is to make sure that we don't have another reason for why they're having that seizure or that electrical activity. We want to make sure there's no bleed in the brain. We want to make sure that there's no malformation. We want to make sure there's no mass or cancer or other reason. But we do have other diagnostic testing that helps us in terms of actually making the diagnosis and actually seeing the electrical activity. Seizures are abnormal electrical activity, and we have a test called the EEG, or the electroencephalogram. So by doing this brainwave test, we're able to see if there's abnormal electrical discharges. One of the things about routine EEGs, which are an hour or less, is that they can sometimes miss seizures. So even people who have bona fide epilepsy and have seizures, if they're in between those seizures, their EEG or their brainwave test may be completely normal. So often what we need to do is repeat that, or we may need to do provocation. What that means is we do things to the patient to try to get them to be more likely to have a seizure. And those things are things that trigger seizures. So we make a person stay awake for longer, so we do sleep deprivation. We may be making them do a lot of exercise. We may be doing photic stimulation, so the idea of the flashing lights to try to bring out seizures. Other times we'll bring people in to an epilepsy lab for longer periods of time. We may do a 24, 48, or 72-hour brainwave test or EEG to try to see if we can see that electrical activity. When we find electrical activity, we also know, based on the results, around where it's happening in the brain, and that can be very useful. Sometimes we need to bring the person into an epilepsy monitoring unit in the hospital, and sometimes even we need to stick electrodes in their brain to try to figure out exactly where that seizure is coming from.